If you had to pick a place to be sick, you could do worse than choose Germany. A country with lots of hospitals and lots of beds.
Normally we don't keep them waiting. It's something like we say, come next week or so.
And what seem to be lots of happy patients.
Alles gut, ja.
But is a health system long regarded as the prototype for modern care still the gold standard of Europe?
The amount of money that is in the system may be on a very high level. The way the money is spent is not convincing.
Or is the German health service in need of a checkup of its own?
You see this on each ward, always the same reanimation set. And in case
so it's like resuscitation, yeah?
Yeah, resuscitation. In case of resuscitation, there's a team for each ward coming, taking that and running to the patient.
Efficiency has literally been built into the structure of the Helios Berlin Bug Hospital, one of Germany's largest and busiest, where operating theatres have been constructed next to each other to allow doctors to move swiftly between them and carry out multiple surgeries, where hidden corridors allow seriously ill patients to be transported quickly away from the bustle of visitors, and where you'd be hard-pressed on any day of the year to find patients waiting in the corridors for beds.
Seldom. In our hospital, perhaps every 2 years.
The medical director here is proud of the fact that in his hospital, operations that you could wait weeks, possibly months for in the UK, are done in days.
We don't have long waiting times, we don't have these problems. We invest, we build, we get bigger if it's needed. What I always hear and see when I'm in the UK is that obviously there's not enough investment in the system. You need to put money into a hospital to keep it running, keep it modern, buy new machinery.
Like other hospitals in the German capital, Helios has extra capacity, extra beds for critical periods, a product of a well-resourced system which allows patients to get treated quickly. In fact, almost too quickly for Dirk Conrad, who we found recovering from a non-emergency heart procedure. He'd barely had time to get used to the idea of surgery before he was on the operating table.
I was waiting at home for a week. I could have been at home for longer, but this way I have it behind me, so the appointment was okay.
It happened too fast is not an observation you'd hear in all national healthcare systems. Still, Mr. Conrad will have plenty of time as an inpatient to get over the shock. Germans spend much longer recovering in hospital than patients in the UK.
Don't forget, a lot of patients like to be in hospital. Sometimes I have a problem to tell them, no, you're ready, you can go home. I said, oh, can I please stay another 2 or 3 days? It's nice here.
The speed of surgery, the long stays in hospital, the cutting-edge equipment are thanks in part to a historically well-funded health system in Germany, dating back more than a century, where money is ring-fenced and where workers have insurance payments deducted at source. It's this man, the first Chancellor of the German Empire, Otto von Bismarck, who's credited with laying the foundations of what is the modern European welfare state. His 1883 Health Insurance Act compelled workers to set aside a portion of their income to protect them from the costs of future sickness. The model persists to today and is based on the principle of solidarity. So the young help support the old, the better off help support the less well off, and workers and employers now share the costs. And it works. Compulsory health insurance guarantees high-quality medical care to almost all of Germany's 82 million citizens. Half taken from the workers' wages, the other half from their employer. Polls consistently say most people are happy with the service they get.
Our strength is that we have the full coverage of some 90% of the population. These people pay a contribution to a sickness fund.
But generating income isn't everything. The demographics of Germany are changing, the population is aging, and the way money is spent is now under fierce scrutiny.
So our system really likes to act and, for example, to operate whenever the opportunity is there. So we do have the highest level of substitutes for knees, substitutes for hips, but everything which is connected with long-term care is a very weak point, and we have real difficulties to keep step with the huge amount of people in need of care and nursing.
Drive a couple of hours from Berlin to the rural area of Templin, and it's easy to see the changing face of this nation. This is where German Chancellor Angela Merkel grew up, and where her mother still lives as part of a growing elderly population. The young are leaving, gravitating to the bigger towns and cities. Family support structures are breaking down. And so in Templin, nurses are taking part in a multi-million-pound trial to take care into the community, a relatively undeveloped area in Germany. Here, case manager Evelyn Steffler assesses the needs of a 70-year-old woman being helped to stay in her own home after breast cancer.
Sie hat durch uns einen Pflegegrad erhalten.
She's got a care status through us. With it, she gets an assistant who helps her at home. She helps with home tasks, hygiene, helps with carrying her shopping because she can't take her up the stairs.
Ja, das würde ich jetzt so sehen.
Everybody wants to stay at home and nobody wants to go into a care home. Absolutely nobody does.
Wo keiner, unbedingt nicht.
It is perhaps surprising in a country which has one of the oldest populations in the world that long-term care for the elderly lags behind other European nations like the UK. Dr. Hans-Joachim Helming oversees the trial in Templin and has a stark warning for Germany about the urgent need for healthcare reform.
People always just thought that things would just work themselves out. Now we realise that it is almost too late. But we have to react now, because things are sharply escalating. The people are getting older and older, and the number of young people going into healthcare professions is declining, and the number of young people who can pay for the healthcare system is declining.
The pressures on the system are not lost on those who could soon themselves be more dependent on care. At the Templin Seniors Club, there's plenty of praise, but also concern about a health service which they've spent decades contributing to. Will it deliver when they need it most?
I hope so, I hope so. You shouldn't always assume the worst.
What do you guys think? Will the health system get better or worse? I would say I have a good feeling about it.
There is a lot of discussion about it on the television, and there are a lot of promises being made, but often they are not kept, and that is the problem.
And the need to care for an ageing population highlights one of the critical weaknesses in German healthcare, a lack of nurses. Tens of thousands more are needed, and the German Nursing Council forecasts there will be a shortage of 300,000 trained professionals by 2030 unless something is done.
Ja, ich sag dir Bescheid. Bitte wiederhören. Tschüss.
This scheme, Care Tiger in Berlin, is trying to draw more people into the profession by making the job more attractive. It communicates with nurses via a smartphone app, sending them jobs close to home.
So our nurse, Christine, she opens the app, she chooses the client.
We left the office to go out and meet Nurse Christine and trainee Sebastian on their rounds. They can get to jobs on 2 wheels and get to know many of their patients well.
Hi. Hi.
Christine worked in hospitals for years and understands why people are turning away from nursing, which has long been poorly paid.
The time, the pressure, the money, you cannot complete the family and the job together. It's very difficult, and it's at Pflegetiger very different. We have so much time for the family, for my daughter, and for the patients.
And Sebastian, who's at the start of his career, is already wondering if his insurance payments will get him the care he needs.
I think when I reach the age of the people I care for, we will still have an acute personnel problem, and I don't think that will change in the next few decades.
It'll take more than private local initiatives to halt what some say is an impending nursing crisis here. Could Germany look to the UK for some answers?
I spent 10 years in England, in Yorkshire. I came to work for my first job at Hull Royal Infirmary and went through GP training and then finally worked as a GP in Driffield in Yorkshire.
Stuttgart GP Dr. Christian Sibilski is a great admirer of the NHS, where he says nurses do more, take on greater responsibility, have better career prospects.
In the UK, minor illnesses are being treated by nurse practitioners, for example, and there are even prescribing nurses, for example, so even for the prescription you don't need necessarily the doctor in person to be there. You can delegate vaccinations. So there are a lot of interesting points we can learn from the English system, really.
The ability to delegate work would take pressure off Dr. Sibilski, who, like other GPs in Germany, runs a single doctor practice as a business. On top of medicine, he is weighed down by bureaucracy, pursuing money from a multitude of sickness funds who pay him for each patient he sees. And those insurance companies are themselves now trying to control costs, setting limits on the number of people he can have on his books.
A lot of time is spent writing the bills, basically, seeing how you get your money. I found it very easy in the NHS, where you don't have to think as much about how to bill people. Yeah? So there is much more time spent thinking how to get the patient well.
People in Germany have the freedom to visit any and as many GPs and specialists as they want, and so-called doctor hopping adds to the burgeoning costs. The country's healthcare system is one of the most expensive in the world, and spending is fueled by advances in technology, where Germany has been at the forefront.
So this is one of our new intensive care rooms at Charité Berlin. It is a whole new concept to develop an ICU environment that enables us to keep sick patients awake, but without stress at the same time.
At one of the country's top teaching and research hospitals, they're taking a new approach to intensive care. Sophisticated light panels are used as part of the healing process, synchronizing patients to day and night. Crucially, patients are not fully sedated.
We know that when we are sedating patients, those patients have a high risk of hospital mortality. They have a high risk for developing acute brain dysfunction and in the long term cognitive and physical disabilities.
The aim is to improve patient outcome, but it could also cut costs.
By preventing these cognitive and physical dysfunctions, we can reduce ICU length of stay, duration for mechanical ventilation, and the hospital stay in total, and that would also reduce healthcare costs, of course.
If Germany is to keep investing in research, there will need to be rationalisation in the health system. It could mean painful choices, closing smaller hospitals, restricting choice, finding alternatives to operations. Change is needed.
The distribution of money that goes into the system is not on a fair level, and it's not on a level that is reflecting the objective demands.
The Bismarck model has proved remarkably resilient, but he could never have imagined when he set it up that workers would survive the illnesses which routinely killed people in the 19th century, that medical equipment would evolve beyond scalpels and needles to the high-tech and highly costly equipment we see today, and that so many Germans would live to be 80, 90, 100. Germany's health service is still one of the best in the world, but in 2018, it isn't perfect. Michelle Clifford, Sky News, Germany.